My name is Dr. Erin Manning, and I'm a benign gynecologist at Houston Methodist. There's really not an indication to check hormone levels during menopause. So the thing with hormones is they are different at different times of the day, at different times of the week, different times of the month. The other reason why it's really not particularly helpful to check hormone levels is that we're not really treating hormone levels. We are treating symptoms. Hormone therapy is medication, typically estrogen and progesterone. It's medication that is used to help with menopausal symptoms. Most common symptoms, obviously, the hot flashes and night sweats. The women who walk into my office and they're having 20 hot flashes a day and they're soaking through the sheets every night, I start those women on hormone therapy and they love me within 72 hours. It really does help. Some of the other symptoms that go along with menopause that I mentioned earlier, those can improve with hormone therapy, but not always. So we always have to have an expectation for what symptoms we're trying to improve. For example, the mood symptoms sometimes improve with hormone therapy and sometimes they don't. Brain fog sometimes gets better with hormone therapy and sometimes it doesn't. One of the biggies, unfortunately, is weight management. We do see this decrease in the basic metabolic rate during the menopausal transition. We think it's likely hormonally related, hormonally driven. So the next scientific question would be, okay, if we give hormones, then can we reverse that curve? And the answer is no. So hormones are going to be weight neutral. In other words, they're not going to help you lose weight, won't make you gain weight either. Hormone therapy is a medication, so all medications do have side effects associated with them. The main risks we get concerned regarding hormone therapy are, number one, there may be a slightly increased risk of breast cancer. The largest randomized controlled study to date shows there were 9 more cases of breast cancer per 10,000 women, so that's a low number, but it was statistically significant. Also, there's also a slightly increased risk of heart disease, heart attack, and stroke. In that same well-designed study, there were 11 more cases per 10,000 women. So again, a low number, but statistically significant. So that's why we use hormone therapy when indicated. There are a number of different medications that can help with the menopausal symptoms besides just hormone therapy. It turns out the medicines that we use for depression and anxiety actually in low doses can help with hot flashes and night sweats. That's interestingly one of the non-hormonal options we can try. There are several other drugs out there that are sort of less likely to help, but they can help: gabapentin, clonidine. Interestingly, we do have a new drug available to help women with hot flashes and night sweats. That drug is called fezolinetant, and it's a really nice new option for women for management of hot flashes and night sweats, especially if they aren't a candidate for hormone therapy.